A is for allodynia.
This means that a stimulus that's usually non-painful is perceived as painful. In the pelvis, it could be touch to the vulvar area that could feel like pain instead of touch.
B is for breathing.
Breathing means that you take air into your lungs and breathe out carbon dioxide. How you breathe has a massive effect on your pelvic health. We'll take a look at just how in the next videos. This is an illustration of how your breathing muscle and your breathing mechanics relates to your pelvic floor. Imagine for a moment that the yellow dot that you are seeing, which is a balloon, is your abdominal cavity. And the top hand is your diaphragm, which is your main breathing muscle. And the bottom hand is your pelvic floor, so the muscles at the bottom part of your pelvis. If you are using your diaphragm to breathe properly, you're actually getting a flattening happening in that muscle. And watch what happens further down. So your abdominal cavity fills with pressure changes and moves out. What happens at the bottom? That pressure changes goes further down to the pelvic area, and the pelvic floor muscles have to relax and release to make way for those pressure changes to happen.
C is for constipation.
A lot of people think that constipation refers only to having extremely hard or difficult to pass stools. So often on the Bristol stool chart, you'll see constipation being described as type 1 or type 2 stools. But actually what we see is that people can be constipated and have a type 7 stool, which is this watery diarrhea stool that we sometimes see. And that can happen when people are so constipated that the soft watery stools actually pass the hard stools that's present in the rectum and come out and looks like diarrhea. So constipation actually refers to how well you eliminate your bowels, how frequently and how easily.
D is for dyspareunia.
Dyspareunia is the official term used to describe pain with intercourse. A lot of people think that it's impossible to have pain with intercourse, but we actually see that very frequently in practice. If you think about it logically, if you've ever had pain where you've had a muscle that's tight and pulling, maybe in your shoulder or your head, it will make sense that having tightness in your pelvic floor muscles, which are the muscles at the bottom of the pelvis there, found in both men and women, can actually lead to pain, and this is sometimes pain experienced with intercourse specifically.
E is for exercise.
Traditionally, people think that pelvic floor exercises is only related to Kegel exercises. And what we see in practice is that Kegels can actually sometimes make things worse. If you look at the muscles of the pelvis, if we tilt it this way, there you can see the tailbone, and that's the front part of the pelvis called the pubic bone. And here on the inside you see the muscles that's usually at the bottom of the pelvis. Those muscles can be exercised with way more than just doing Kegels. And very often we actually need you to release the muscles first before being able to train them in a proper way.
F is for frequency.
Frequency refers to the amount of times you go and empty your bladder per day. So if we take a look at this little yellow dot there at the front of the pelvis, it represents the bladder. The bladder fills up and it squeezes when it's full, and then it's supposed to empty. So a normal frequency would be going to empty your bladder about 4 to 7 times in 24 hours. If you do less than that, you have a reduced frequency, and if you have more than that, you have an increased frequency.
G is for genitopelvic pain and penetration disorder.
This is a term that has recently been introduced to describe an umbrella of different symptoms and previously defined conditions. So this refers to any pain in or around the pelvis or genital area, or pain related to penetration specifically.
H is for hesitancy. Hesitancy refers to the inability of the bladder to start urinating. So when the bladder is full and it gives a little squeeze, it will communicate with the brain to tell you that you need to go to the loo. But sometimes when you get there, the bladder might not start to actually let the urine out. And that is referred to as hesitancy. I is for incontinence. Incontinence refers to the involuntary leaking of either urine or stool. So if you look at the pelvis, you've got your bladder at the front that's usually filled with urine and your rectum at the back that's filled with stool. So either one of those could leak or both of them could leak, and that could then cause incontinence. If the bladder leaks, it's referred to as urinary incontinence, and if the bowels leak, it's referred to as fecal incontinence. J is for joints. So if you look at the pelvis, there's a couple of joints that can actually have an impact on symptoms around the pelvis. If you start looking a little bit higher up from the back, you've got joints from the spine that actually go and attach to the pelvis. And then at the back, you've got your sacrum and your two bones on the side that form the sacroiliac joint. And then if we look at the front, if we turn it around, you've actually got your pubic symphysis, which is another joint that can be affected and cause symptoms. From the front, you can also have a very nice view there of the sacroiliac joints, and you can see that they are quite large joints, so that can have a big impact on the way your pelvis functions. K is for Kegels. So Kegels refers to the exercises of the pelvic floor that was traditionally prescribed to women first after giving birth. L is for laxatives. Laxatives are aids used for constipation or just to soften your stools, make them easier to pass, or to even go more frequently. It can range from just changing things around in your diet to actually using medication to soften your stools, or to using suppositories or enemas to actually help it soften and come out a little bit easier. There are some other laxatives that you can also add, but usually we start with the basics of adding enough water and fiber and then moving on to other things that we need or might need. M is for mindfulness. Mindfulness is the state of bringing consciousness to either your environment or yourself. In pelvic health, we use it specifically as a tool to reconnect your mind to your body and what you are feeling and experiencing inside your body. N is for nocturia. This means that you get up at night to urinate. It is normal to get up 0 or 1 times, but you shouldn't be getting up more than that. Our bladders actually should be filling less because we produce less urine at night. So if you are struggling at night getting up more than once to go and urinate, you might need to go see your pelvic floor physio. O is for obstructed defecation. This means that you are struggling to get stool out of your body. Sometimes the answer is as simple as changing the way that you try and poo. P is for pelvic floor. So pelvic floor is the muscles that's at the bottom of the pelvis if you're standing up. What you're seeing here is a view as if we're looking from the top down into the pelvis. Both people who have penises as well as vaginas have the same muscles that's in the pelvis. The pelvic floor also has muscles that are closer to the skin, and these are often forgotten. So this view would be as if you're looking from the bottom up into the pelvis. So that's kind of what we see if someone's lying on their back and you are looking at their pelvic floor. Q is for questions. When you have an evaluation with a pelvic floor physio, you will be asked loads and loads of questions about your bladder function, about your bowel function, as well as your sexual health. You should also take a list of questions that you would like to ask your provider with, so that you don't forget anything that you might want to know about. R is for retention. When speaking about urinary retention, it means that the bladder does not empty. So sometimes after certain procedures or surgeries, when the catheter is removed, the bladder does not start urinating by itself, even though it feels full or it is full. If this ever happens, it is an emergency. You need to speak to your doctor about it and find a way to actually empty your bladder properly. If you do not get it emptied and it stretches beyond its maximum capacity, it can actually lead to permanent damage. S is for SIJ or sacroiliac joint. It's the joint formed between the bones of the last little bit of your spine and your pelvis. So if you look at the pelvic model, this would be your sacrum, and this part of your pelvis, so that big bone on the side that you can feel, is called your ilium. So the joint that's formed between those two is your sacroiliac joint. So we are very good at treating whatever's on the outside of it, but we often forget that there's an inside part and muscles and a whole bunch of structures that actually attach to that sacroiliac joint on the inside there as well. T is for toilet. So toilet is the structure that you sit on when trying to urinate or defecate, even though some people do not use the traditional toilet as we know it in a lot of areas in the world. So a toilet is a wonderful invention, but it can actually come with some problems if you're not using it correctly. So having a proper setup and knowing the proper mechanics of how to use the toilet can actually improve your pelvic health. U is for urgency. When talking about the bladder, urgency refers to a very strong feeling of needing to go and urinate. It can lead to severe distress and someone always having to be aware of where the nearest bathroom is. V is for vulva. Very often the female genitalia is referred to as the vagina, but the area that we actually see on the outside when looking from the bottom up is actually called the vulva. W is for wand. A pelvic wand is something that can be used to treat the pelvic floor muscles. So it's something that can either be used in practice or even at home if appropriate to reach your pelvic floor muscles. X is for X-rays. These are images that go and look at the bones and some other structures in the body. In pelvic health, one of the most helpful X-rays that we can use is a KUB or a kidney urine bladder X-ray, and we use this a lot in our pediatric patients to go and look for constipation. Y is for you. You are the main person involved in whatever symptoms or problems you have. So if you have a provider, make sure that they listen to you and your specific needs. Make sure that you are put at the center of the discussions, the evaluation, and the treatment plan to actually address your specific concerns and not what they think should be addressed. Z is for zinc. Zinc is a nutritional supplement that can be used, and there has been some studies looking at the effects of it used in combination with some other supplements for postpartum healing as well as for period pain, and it had good effects. As with all supplements, it's important to note that not everyone will have the exact same response, so adding one supplement at a time and then actually monitoring the response in yourself is recommended when trying out new supplements.